So we'll start a little bit with the knee is probably the most commonly injured, the common injury, if you will, for running, most complained about. It's what we see the most when we're dealing with runners, and that can be anything from like anterior or front of the knee pain, like hamstring, outside of the knee pain. A lot of it you might hear of like runner's knee or even some of arthritic conditions can be due to sort of improper running or some weaknesses or some inflexibility. So tonight we'll just do a little bit of some exercise to help strengthen the knee, and then if anything else pops up, we can address that as it comes up. So when we're looking at the knee, even though the knee is the reason that people come in to see a physical therapist, whether it's the two of us or the two of them or any other PTs in town, yeah, pointing to them, calling those guys out. So there's more of us here tonight to answer questions. So the knee is, unfortunately, sort of caught in the middle, if you will. It's sometimes in class, when I'm lecturing in class, I talk about it being a stupid joint because it kind of follows what happens below or above. So the foot and ankle can dictate what happens to the knee, or the hip can dictate what happens to the knee. But the knee is the reason that you guys complain of pain and then come in to see somebody or go see the doc. So you'll see some of the exercises we talk about tonight, or that we'll have you do tonight. They don't target necessarily the knee, but something that would contribute to some stability for the knee. Right? A lot of other things will cause or contribute to knee injuries. Just the way that you run, the surface that you run on. Certainly here, the shoes. How old are the shoes, or are they the right shoes for you? So understand that it's not just what we're talking about tonight. There could be quite a few things that contribute to some knee pain or some knee soreness or some problems going on with the knee while you run. Some of it can be addressed here, but there are other things outside of what the exercises we're going to do tonight. So if when I say that the knee is sort of the stupid joint or follows what's happening above or below, if I just sort of briefly give you an idea, I don't expect you to remember this after you leave here, but if you can sort of understand it as I go through it, then maybe it'll help you when we come to the exercises. You'll get a better understanding of why we might be choosing to do some of the exercise. So, are you familiar with pronation or supination? Not you guys, but you've heard the terms anyway. So pronation is when your arch goes to the floor, right? Supination is the opposite, is when you have a higher arch. Well, when you hit the ground, when your foot hits the ground, you're going to go into that pronation, and it doesn't just stop the foot and ankle. Your knee goes towards midline or middle, and then your hip is also going to follow suit. So your leg basically collapses in. Right? It's normal. You hear in the literature a lot, or on the news about overpronation, or when they're trying to sell shoes, they talk about overpronation, and it's sort of questionable what overpronation really is, because the arch really only moves maybe 2 millimeters. Okay, it doesn't really move a whole lot. So the question is, what kind of control really? It's not how much does it happen, but what kind of control happens when you pronate. And a lot of that comes from the hip. When we have knee problems, we want to address the knee. The kneecap really only has one muscle, but maybe 4 parts of that muscle that attach to the kneecap. But the hip has about 27, 28 muscles that attach to the top of that thigh bone. So we're really trying to address what happens at the knee further up. So if we can strengthen here, we can have better control at the knee. And so some of the exercises we're going to talk about tonight really are going to address the hip. Right? Doesn't mean that the foot and ankle are left out of it. We're going to touch on it in a few weeks. We're going to address the foot and ankle concern. But we're taking it transition from our last seminar to today, and just have a better understanding of why we're doing some of the exercises.